So I'm going to open this to all of you, for all 5 of you actually. But I think it would be really interesting to think about what the opportunities are to better name and then align, because all of you spoke, you know, it's fine to name, it's fine to have them in a strategic plan, it's fine to have all of that work done around a strategy or strategic pillars. But how do you align those values with the on-the-ground practice? I hear service delivery practice, what different practitioners were doing, but also around programs and policies that were, and orders, I think, you know, both health regions, both regions would have put in place public health orders, so that really high-level policy. So what are the opportunities to better name and align intended values, and then putting those into action or into practice, programs, services, policies? So I'll just maybe open it up there, including Pemma. So just if we'll see how it goes, and maybe each one of you can speak to that, whatever order you want. But I'm going to ask people in that chat box to put in their questions if they have questions for this panel. So I'm just going to watch, see who unmutes their mic. Who would like to speak first to that?
I can maybe start off with some initial comments.
Sure, thank you. Thanks for that. Go ahead.
I think, you know, I've talked a lot about we have a strategic plan here. And I think, you know, many of us have probably heard the phrase that culture eats strategy for lunch. The idea at the end of the day, nobody's looking to a strategic plan to figure out how they go about their day-to-day work. People, when they go about their day-to-day work, aren't actually, you know, pulling up the policy of how am I supposed to go do this task? Maybe if it's a new task and it's pretty technical, they'll do that. For the most part, people aren't doing that. What really drives how they do that is the organizational culture. And I think that's why this values discussion is so important, because I think that values part is really key. So, you know, I think absolutely the first thing we need to do is to be building that organizational culture. And you know, I've talked about, you know, a few things that we've tried to do that, you know, phrase impact on health and health equity, using it all the time to try and elevate it as something that we would all share, having that, you know, shared performance objective across all of our non-union employees, so we all align around that. Some other things that we've done was to try and really make routine consideration of health equity part of what we do at our organization. So, you know, looking to the, you know, NCCDH role for health equity around modifying and reorienting programs. One of the elements of our health equity strategic plan is that every program needs to, on a routine basis, every several years, go through a health equity impact assessment. And that's another, you know, area that Kate is very involved in helping to lead. And the idea is to force every program to stop, think, take a look at what they're doing in terms of health equity, and making sure we're doing as best as we can to mitigate the impacts and hopefully find ways to actually advance that forward, and taking that conscious look periodically. And so I think that's another way you can kind of do this, to really build in that we're going to consciously build in that we need to think about health equity. And if you're forced to do it every once in a while, hopefully it becomes one of those background values that we're all thinking about. Another way we're doing it, maybe looking less just internally at our organization and maybe a bit more externally, is, you know, the NCCDH role has the role around influencing policy, and that's an element that we want to start to make some progress towards in our strategic plan. And a key element there is that one of the parts of our plan is that we are going to start within our media releases, in our public communications, routinely talking about health equity and the social determinants of health and the impact that makes, and hopefully building a public understanding of how important these are, and hopefully eventually getting to having some public readiness, speaking back to what Pemma talked about, of the importance of having that readiness before we can act. And hopefully we can build that on a society-wide basis, or at least Niagara-wide basis, so we have that platform to move that forward.
Thank you. Those are some really excellent examples, and that making it routine is like making it a habit, right? And using those words, so naming it, using those words over and over again. And when you talked about with the, you know, your media and your opportunity to speak to the public, I think about, you know, people who say putting that public back in public health, right? That this is about the people, this is about them. So putting that and using that opportunity to educate, really, or to engage. Those are great examples. Anybody else want to speak to? Go ahead.
Yeah, Claire, if I could weigh in, it's almost, I fully agree with Mustafa. It's about trying to make this second nature. And what's very fascinating, at least from our experience in Peel, is that in the lead up to health equity being declared a strategic priority in our 2020-2030 strat plan, we did undertake a number of workforce development engagements. We were trying to, teach our staff internally around not just the concepts, but then exercises that we're really trying to have them understand, how to apply a lens, how it applies to their day-to-day work, really having. And so what was most interesting about the pandemic was that we were no longer given the luxury of time or that energy to be able to do that. As you can imagine, 2019, we were given plenty of time because many of our programs were paused following the public health restructuring appointment. We took the opportunity really to try to get more health equity content into public health practice. And so I would say the thing that I learned, out of really trying to build this on the fly was just how important, and I think Paula named it, out of the values we had, which were really, humility, accountability, and trust. How important humility really is, the value that underlies so much else in terms of what you do, in terms of equity work. Just a recognition that you really, especially where minutes and lives matter, especially where you don't have the luxury of really working through things, then you need to actually be listening, and you need to actually be fully aware of your limitations and your understanding. And I think in the course of this response, we've had many situations where we have fully recognized the limitations of our scientific understanding or the limitations of the data that may be available to make decisions for us. But I think qualitatively, when it comes to equity, a full understanding of the limitations that we have as privileged, well-to-do public health practitioners, of how the pandemic might be differentially impacting or preying upon disparities, really bringing to life some of the numbers we were seeing was crucial, and also the humility to actually understand and know that we don't necessarily see what is immediately needed or how an approach might be taken to fix it. So I think that willingness to be open, that willingness to listen, that willingness to engage with the community, that willingness to say, we don't know, teach us, lead us. I think that was really critical, important for us to close the gap between where we didn't have the luxury to necessarily train up staff in a rapid fashion, and to also be able to get the information to quickly say, okay, maybe we should look at how we're doing testing. Maybe we should look at the testing outreach. Maybe we should look at these aspects of the immunization rollout or other aspects of the response.
Those are great examples, Lawrence. And, it strikes me as a public health practitioner, longtime public health practitioners, that we sort of would have espoused that we were doing all of those things, but that, that jolt, if you will, to say, oh, okay, course correct here. You maybe are aspiring to them, but on the ground, are you really doing what is needed to be done? Paula, Kate, anything you want to add there in terms of opportunities? Really, there's been some excellent concrete opportunities to take those learnings or teachings. What is COVID teaching us and moving them forward? Kate, Paula, and Pemma.
I can just add, Dr. Hirji kind of mentioned a few activities that are as part of our health equity strategic plan, but another one, which has also come out from the pandemic, is kind of standardized collection of sociodemographic data. So that's something outlined as an objective in our health equity strategic plan that we're hoping to move forward this year, actually. In that we've seen it, I think Ontario Health just released a report on race-based data of COVID to kind of show the disparities in COVID cases across different ethnicities. And so that's something that I think is really important. And I think Pemma mentioned, though, that the challenge that comes with that is once we have that data, how do we translate it to action? So that planning component of that work is, I think, really crucial. So that's a big thing that I think we'll want to prioritize for that work specifically. And then another part I think that was mentioned as well is just kind of general skills and knowledge and awareness of health equity issues in the community, priority groups, culturally appropriate care. So that's something kind of outlined in our health equity strategic plan too, to kind of support all staff, frontline and clinical and non-clinical, and having a better understanding and sense of how to support different groups in the community.
Great. Thanks, Kate. Paula?
Great. Thank you so much. I think one important piece, for us to think about moving forward in our health equity plan, and we did acknowledge and recognize the importance of engagement to support the work. We have a totally different idea about what that means. This has really, the pandemic response has really taught us that engagement is more than, informing our partners of public health practices, which is important, public health measures, but it's also important to think about engagement kind of across the span, across at every, interval or along, more of a journey, per se. So, we need more engagement than just supporting, let's say, outreach activities. We need engagement to help inform us like where the priorities should be and where the priorities lie, and our community should and community partners should be involved in discussions around data collection and what outcomes should be measured versus the ones that we have listed in front of us that we're mandated to collect, but what are the issues happening within the community. And I think this response has shown us that engagement is far reaching within every corner of our work. And I think being more intentional and explicit about how we go about doing that, I see it as a great opportunity moving forward.
Fantastic answer, both Kate and Paula. And just from my perspective, one answered with a great deal of humility. So thank you, both of you, for those answers. And it feels tall, right? It feels big in front of you as you're looking forward. But I think talking about it, beginning that dialogue, engaging and moving into those conversations for sure is a really solid first step. Pemma, I'm going to come to you, but I noticed that there is a question. We have about 10 minutes left here in our webinar. And this, let me see, it's Eric asking the question again. It says, I guess I'm asking this. I'm just going to find it again. I guess I'm asking.
Yeah, Claire, I think I've been following that exchange between Dr. Hirji and Eric. I think he was just sort of clarifying. They were just having a bit of an exchange on the chat box.
Okay, so I'm going to ask anybody else who might want to put a question in there. Thanks, Pemma. No problem. Do you want to respond to that opportunity question then?
Yeah, sure.
The other four panelists. Go ahead.
Yeah, so I put a link in the chat box. I already mentioned this tool at length in the early sort of framing of the presentation, but I just wanted to put the link in there because at the end of that tool, there is a sort of table, and participants can go over it in their own time, but it really looks at areas of organizational capacity development and examples of desired organizational behaviors and actions that support health equity action. And it's sort of broken out into different parts like lead and govern with equity, develop a culture of equity, build a robust and competent team, build multi-sectoral and community relationships to enhance action on the social determinants of health. And I think a lot of those things came up in the comments we heard from our speakers so far. And so there are really concrete ways that you can go about doing that. And they're just examples there for people to draw from as they engage in that kind of planning process and that imagination scenario building process of, if we want to prioritize this, this, and this, what do we actually do about it in the short, medium, and long term? And so I just wanted to call people's attention to that. And with that, I mean, I know this is shameless self-promotion here for the NCCDH, but I just want to say one of the ways that, one of the opportunities that public health can take to better align values with practice is actually do what Dr. Hirji and Kate spoke about so well, and what Dr. Lowe and Paula were speaking about being in the process of and having to kind of pause on doing and then revisiting, which is actually sitting down and creating a plan, whether you call that a strategic plan, an organizational plan, a departmental plan, but actually taking the time to, in a small group of organizational leaders at different levels, including health equity focused staff, sit down with each other and think, what is most important to us? What are those values that are going to drive our work, have driven our work, do drive our work, are most important to us? And then linking those with concrete actions and ways of being in states that you're aspiring to in the short, medium, and long term. And there's, I think, even in hearing some of the great ideas that the speakers have shared today, including what is written down, what's not written down, what they learned along the way, I think there's so much power in actually engaging in that kind of exercise. So I would say that's a big opportunity waiting to happen at many different regional health authorities and public health units across Canada. And you can use our tool to do it, which is the shameless self-promotion plug.
Thanks, Pemma, and thanks for that plug. And I think the tool, it's not a long tool, so and it's very focused on as Pemma said, putting those equity values into action, and it's a dialogue tool. So I think we've been talking about dialogue. So I'm going to ask each of the panel, as we come to the end of our conversation and our dialogue today. It doesn't look like there's too many questions in the chat box, so we'll just leave that there. To give us just their final thought or thoughts or tips or advice to this audience and to the NCCDH, please feel free as we conclude our conversation and our dialogue today. But as we're doing that, I'm going to actually ask if those online, those participants that are with us here today, if they've got their own example, Niagara region kind of put their hand up and said, I think we have a story to tell about equity to action that we'd like to share in a webinar. And Peel certainly agreed very readily to come on side and to participate here today. But if you've got a story, and we know there's many out there about equity to action that illuminates values, illuminates putting values in action, please put your email there, and we're going to tell some stories. We're going to try to lift up those stories as a form of evidence on our website. So we would be really, really happy to talk to you and to interview you and to lift up your story and get some of those that good sharing occurring. So please put your email address there and say, you know, I'd like to share a story. So I'm just going to go around this virtual room, and Pemma, I'm going to start with you in terms of a tip or a final advice that you would like to give this audience today. What's your best advice?
Oh, I think I gave it, but I will reiterate it, that I think that just taking the time to think about this and being kind and humble and compassionate with yourself as you do so, to engage in that kind of what is most important to me. How does that play out in when I enter my organization? What is most important in my organization? And what does that mean for the work that I have the power to do? Is a really powerful exercise, no matter where you sit within the system. So to embrace that and to do it bravely and courageously and vulnerably and all those good things.
Thanks, Pemma. And for us too, the NCCDs consider themselves to be an integral part of the public health systems across Canada. So yeah, for us as well. Thanks, Pemma. Dr. Hirji, what would be your sort of parting advice to the group today?
Yeah, so I think there's two parts. You know, I think we've talked a lot about values, and I think that's really key. Speaking the values, trying to act around those values, sharing the values, really, you know, communicating the priority around those values. I think that's really key to building that culture that hopefully makes this second nature and moving forward. And then, you know, I just want to pick up on, you know, something Lauren said earlier about humility being so important. And, you know, I think Paula's last statement about how, understanding how we engage and address health equity, her understanding is totally different. And I couldn't agree with her more. My understanding of health equity is completely different, 18 months from now versus now. And, a lot of the thinking that probably went into health equity strategic plan, if we went through it again, would probably be different. And so I think really living that value, I think, is probably very important, because we don't know, we haven't solved how to improve health equity. We're all trying to take steps forward, and hopefully we are making small steps forward, but being humble enough to accept that we're not going to get it right. We're going to be continually learning new things every day. We're going to be course correcting, adapting. I think that's really key.
Thanks, Dr. Hirji. I'm going to go to you, Paula, and then to Kate.
Thank you. I think my piece of advice is will be a little bit different. I think, and I don't want to speak for everybody on the call today, but maybe I can speak to many people attending today, that doing this work is really hard. You're constantly faced with really challenging concepts and really challenging conversations, and often difficult conversations, and even with your internal self and who you are as a public health professional. It's certainly something that I have found to be at times just really, really hard. And I think my tip would be to just, keep going. And when things are hard, just realize that stopping to listen to other perspectives from community will help carry you, and it will help you to feel like you're in a place that you'll be in a better place to support health equity. So I think that's just my closing thoughts to share.
Thank you, Paula. That's a very hopeful closing comment. Kate, what would be your final words of advice?
Yeah, one note I actually had written down as an opportunity is, Pemma, what you plugged, is to just leverage existing tools and resources, so especially the NCCDH tool. But on that topic as well, I think, which Paula alluded to as well, is really engaging with the community. And even that, like an opportunity like this to engage with other health units and regions of kind of what their approach is, I think is really key. So I guess the tip would be to don't act siloed, and try to engage with everybody and learn from everyone. And then it speaks back to kind of that key value, which I keep going back to, is humility. So yeah.
Great advice, Kate, and practical, right? We can do that. We can do those things and know that we're in this, we're not alone, right? Lawrence, final words of advice?
Well, I mean, it's interesting because I don't like batting cleanup on these things, because I think there's been so much wisdom that's been shared before, and I don't necessarily know what I'll be cannibalizing or not. But just to build, if anything, on what Mustafa had identified, my advice would be it's about looking forward at this point in time. And one thing I'm very fond of saying is that sometimes it's kind of interesting that it takes a disease that spreads from person to person to remind us that we're all connected, and to ultimately remember that we need to, we're only as safe and as strong as our most vulnerable. And I think Mustafa's point around if you write a strategic, the strategic plan you wrote 18 months ago would not look anything like the plan today, but really taking these lessons, taking the relationships, building on them, working on them, and recognizing that even beyond COVID, there will still be equity issues that need to be addressed together. That's one thing. I think the second thing that I would urge is even with the humility and even all those other things in the conversations with partners, there are certain things that I'm according to Myers-Briggs, I'm one of the people that trust my gut more than my brain sometimes. But when it comes to equity, there are certain things that just don't pass the smell test right away. And I think when you have that sort of uncertainty or tension, it's always good to try to ask trusted partners or trusted parties about it. Again, going in with that sense of humility, just saying, this doesn't quite make sense. This doesn't quite meet the mark for me. I hate to be the bearer of bad news, but some of you may have seen it since it's just breaking now. But the US is going to be offering third doses to every American 8 months after their second dose. that doesn't pass the smell test for me, especially in a world where there's equity considerations and global access to vaccines. But it's stuff like that. I think to the extent that I always believe that humans are intrinsically good, I think we intrinsically have most of us, I think, the vast majority of us, have the wherewithal to notice where things aren't just quite adding up. And I think that's always a sign to reach out to trusted partners and to approach with that humility to understand. And I'm sorry that my remarks pushed us over a little bit beyond, but I'm just incensed about the announcement that I just read. So I thought I would take the time.
You put it in there. Thanks so much, Lawrence. And you know, that gut is evidence, right? And so trusting it and you know, sometimes just sharing and starting a dialogue around that will help to underpin that and lift it. So in the chat box is the evaluation. So I'll remind you, and it's also, I think, up on the screen. But thank you so much to the 5 of you. Pemma, you included, you are our staff, but you brought yourself to this, and I really appreciate that. Thanks, Kate. Thanks, Paula, for all that you're doing. Thanks, Mustafa and Lawrence, for your hard work. And thank you all for taking time today out of what I know is a very, very busy schedule to be with us here today. We are very grateful to that. So with that note, I'm going to sign off and ask everybody to have a good day. Have a good rest of your day.